So the genesis of why I even sought out stem cells is that 4 years ago, I had COVID. I was hospitalized for 7 weeks. I had respiratory failure, significant kidney dysfunction, and I had a severe cardiac inflammation called aortitis. I was frightened, and I told my pulmonologist, I said, this looks like a postmortem. And she says, yes, they do. Your lungs are a disaster. And most of her patients are on oxygen. I came home from the hospital using a walker, and I was on oxygen for months. In Antigua, because they were using a really good stem cell line, their potency was about 90 or 95%. And I decided, even though these treatments are not inexpensive, it was an investment in my health and my future. So I had 4 days of infusions, and I had 200 million stem cells. And I'll back up a little bit. Before I went, I had all kinds of lung images, which I sent. So I had blood work done and imaging. And my diabetes improved from 8.4 to about 7.4, which is a huge, when you move up an entire percent, that's a lot.
Wow.
I had more energy. I felt better. And you understand that I'd spent several months walking around with a walker and oxygen. Within a year, my lungs had improved, and I'm 77. I now weigh what I weighed as a junior in high school.
Wow.
So I now weigh 159 pounds. I have no cardiac inflammation. I had a CT scan of the lungs last week. I have no scarring at all in my right lung, and I'm 90% improved in my left lung. My scarring in my lungs look like a person who had died. Just as a matter of course, I now have all my meals on a salad plate, which is half the size of a regular dinner plate. So I eat much smaller portions. I eat lots of vegetables. I eat lots of salads. I cut my meat consumption red meat by about 90%. So I now have a pretty solid Mediterranean diet. I increased my exercise, and I think the combination of the original stem cells and deciding that I'll eat a good diet, I'll exercise, and it made the improvements, I think, significantly more effective. I haven't had any stem cell treatments in almost 2 years now. Respiratory failure, I never would have survived the COVID. So the fact that I didn't smoke. When you have liver inflammations, if you're drinkers, if you drink, your liver function declines. So I don't drink and I don't smoke, and I don't miss either one. So if you employ lifestyle changes in addition to the stem cells, your improvements will be markedly greater.
It's an investment in your future self. You know, I loved how you said that, because that's how I view it. It's like, if you don't have your health, the rest of your life is going to be difficult to manage, right? It's going to be hard to work. It's going to be hard to be productive. It's going to be hard to, play with your grandkids or your kids. So I like how you put that as an investment.
I'm actually going back the end of next month for a whole new set of treatments, plus the exosomes, and it's called their golden bag, and I'm just pretty excited to see what it will do. If it does half of what my other cells did, I'll be 35 years old again. And this is actually called, this is regenerative medicine. And I understand that there's a number of professional athletes who have had injuries and and bruising and other things in their sports, and they're going down to get infusions.
And you know what? I'll even say for myself, and I know even the people who own the clinic and our head doctor, we all have this heart for people and to see them get better, not just manage symptoms, but treat disease. And we're working even with patients that come to get their stories and get their data so that we can have more data in this space to make this more accessible to more people.